Spine Institute, Surgery Center Viera on February 24th, 2022. We're going to be doing an L5-S1 Deuk laser disc repair for a L5-S1 annular tear with inflammation and disc herniation. We're getting ready to get started. Just lay still, all right?
You're doing great, sweetheart.
You're doing good. Just lay still, okay?
Keep your buttocks still, hips down, like we talked about. Good job. There you go, you have one already.
Shot. All right, so we're using an x-ray machine called a fluoroscope. It's a very high-tech piece of equipment, and this is allowing me to navigate from the outside world down to the spine. Shot. That's interesting. Num num. That is not what I use on the skin. You guys should always have local ready, so I don't have to wait. Let me have it, please. All right, so we're just giving our patient a little more numbing medicine. Don't make me spank your bottom. Shot. So I would drop the table. So you got way too much view in front of the spine. You guys got to get this right. So the spine should almost touch the right border. Drop it, stop. That's a little too much. That's amazing. We're really low, lower than I thought we would be. That's interesting. You've got to tell Monica, this is you and him. It's not me. It doesn't involve me. That is definitely not good. Should you ever collimate the front of the spine? Should you ever have to collimate the front of the lumbar spine? You adjust the table. You drop it because, you know, why keep going up when you don't need to? You're doing great. Hang in there. We're just trying to find the right place to go in. Shot? So I would bring the spine. It's almost perfect. I would bring it down a little further. Table down. Quarter inch. Just tell them quarter inch, half inch. That's good. That's good. That's good. All right, good. Shot. Okay. Shot. There we go. All right. So because of the angle of L5-S1, we're having to start further north or towards the head than normal. And that's okay because we're prepared to do that. Everyone's different. Shot. What I've got to do is just figure out the right starting point. We're on the facet. I need to get around that facet. Otherwise, our trajectory looks pretty darn good. Lay still. Shot. You're doing really good. Just try not to move. Shot. And it, you know, you can keep her where you need her to be safe. Shot. The good news is we will get there eventually. Shot. So we're getting closer. Shot. 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 So the shot, the needle, I want it to go further south, but she's deflecting me with her tissues. We're pushing the needle away. Shot. This is a little better. You awake? All right. Shot. At this point, we're going to go with an AP. Give me one more lateral and an AP. Come on. I can't see the needle. There we go. So if you look at the needle, the tip of it is right where what we call the facet joint is in the back of the spine. So that's what that big black blob is. It's really two bones coming together. Yep, that looks pretty good. It may need to be a little bit more medial. I'm about to figure that out in a second. Let's see where we are in the lateral view again. Actually, we're perfect. So I'm going to keep aiming south towards the feet just to get the proper position. Are you awake? Is that a yes? Shot? I'm not happy with that. Shot? Shot? Yeah, I need to be a little bit more lateral. Shot? Shot? So for those of you paying close attention, you'll notice that I adjust my position of my bevel of the needle. I'm moving it so that I could adjust the trajectory. Shot? Again, I feel that right there. Shot? Feel like I'm right on the disc. Let's get an AP. Now an AP means an anterior posterior, which is a front back x-ray. I'm going to be looking through the belly to the back, and I'm using the front back and the side to side view. That looks pretty darn good. Huh? What? So Kevin, they're complaining about a crackling speaker. Went away. Huh? Is it back? Shot? Shot? I guess we're having a crackling of the speaker for some reason. How is she? Shot? Shot? Yeah, good. I'm rubbing right against the facet and shot. It is deflecting me a little bit laterally, but I think that's good. You doing okay?
She said yes.
All right, we're right where that bad disc is. Shot?
She felt that.
Yeah, I'm sorry. I know it's uncomfortable.
Your back or your leg? Back.
Yeah, we're in the right disc. Shot? All right. So at this point, we've accessed L5-S1. Let's get an AP. We want to make sure now that it is indeed the source of her pain. So we're going to wake her up, make sure she's awake enough. I do want to confirm that we're in the right place. Okay. So that's a little bit lateral. Can you, wait, go back. Get me those spinous processes lined up. Just wait. We're right there. Interesting. Huh. Let's go back to a lateral view. One more time. All right, I can't really see the needle because I need the stylus. Come on. Shot. Are you comfy? We're lateral in the disc. I'm not really terribly happy, but the facet has forced me wide, and I've already tried several times. Shot. Shot. Give me an AP. I'm just going to try a little dye injection, make sure we're inside the disc. This is why we call it a discogram. Shot. Is that going across the disc? Can you see that? It looks like it's going across the disc, right? Shot. Yeah, that's definitely going across the disc. So we are in the right spot. How bad is that on a scale of 1 to 10? Shot. Lateral. All right, 25. Okay, okay. Quick lateral, quick lateral. Let's just get a nice lateral. Is that where you typically get back pain? All right, sweetheart. The pain will be gone when you wake up. You get to go to sleep. All right, so that was concordant, 25 out of 10. I want the marking pen. Let's go to the marking pen. So for those of you watching and the patient and her family, we always record the surgery as long as the patient wants it to. But I just put the needle into this bottom disc. That's the one we're operating on. We call it the L5-S1. And that's the one we're doing surgery on. She's definitely got a bad disc. You can see it on the MRI, but you don't know if it's causing pain or not. So we just tested it by putting the needle into it and injecting the dye. And the dye leaked out. And it really activated the inflammation inside the disc that's already there. And it caused 25 out of 10 pain. So I'm going to write that number down. 25 over 10. So I asked her, what's your worst pain that you get out of 10 out of 10? That's what the anesthesiologist and I asked her, and she said 25. So, all right, now we just got to make sure we can navigate into that disc properly because we are a bit lateral. Shot. I'm going to take I'm going to make my incision with a number 11. This will be a 1/4 inch incision, and I'm going to open it up medial and lateral. I mean, what's going on with our local? Why is it not working? Huh? Oh no, it's all right. I'm putting some more local in. But what I don't understand is why it doesn't work. Yeah. I hate to say it, but it's Chinese manufactured shit. Listen, I like Chinese people. Don't get me wrong. How do you know it's from Illinois? And what does it say?
It says it's from Lake Zurich, Illinois, and Zurich, something.
But it says from, right?
Yeah, that's,
But what does that mean?
I don't know, should I look up the company?
No, but my point is American companies import Chinese pharmaceuticals.
They absolutely do.
Okay? And then they repackage it. Okay? It's like these people that buy methamphetamine online from China. I don't know if you guys know this, but on the black market, you can go and buy this much methamphetamine from China for like $30. And then they take it and they import it into Illinois, and then the local drug dealer cracks it up with a little hammer and chisel, puts it in little baggies and says, from Illinois, your local meth dealer. Okay, it doesn't mean it's made in Illinois, it's made in China. But it's, you know, what do you call it? Compounded in Illinois.
They mix it with fentanyl now, too.
Yeah, my point is very simple. Just because it says it's from Illinois doesn't mean it was made in the United States. Most drugs now are made in China because it's so much cheaper to manufacture them in China. And why is that? Because they're not putting any drug in there. This is why the local doesn't work. It's not like the patient's body suddenly lost its sensitivity to lidocaine or, huh?
I agree.
Or Marcaine.
Stop blocking the sodium channels. That's making me look bad.
Well, what it does is it's dilute. It's kind of like, okay, I've got this pest control service, right? And they come out and spray my lawn for weeds. And yet I've got weeds growing like crazy. I got, what is that thing? The chinch bugs killing my lawn. And they're spraying for chinch bugs. My point is simple. There's no chemical. It's just water. Because what costs money, water or chemicals? Chemicals. So they charge you for chemicals. They spray water. You can't tell the difference except your lawn looks like shit. Same thing here. We're putting in local. There's no effect on the patient. So what are you putting in? You're putting in sterile saline. That means the drug is not there. It's not there.
It's making me look like a chinch bug.
You, a chinch bug. All right, it's okay. Lay still. Shot.
It's a little
She needs a little more propofol. At least the propofol works.
That's like the only bug that I have at my house, but they're annoying.
How do you know? A chinch bug, if you look at your grass, it's brown and dead.
And you peel the bottom of the grass up, and it's under the.
No. You look at the dead grass, and if it's in little pieces, like it's been eaten. So if it's intact blades of grass that are dry, that means not enough water. If it's the blades of grass are chopped up into little pieces, it's a chinch bug. Yeah. And they look like little islands of dead grass. She's lay still.
Give me some more medicine. You're doing great.
Shot. All right. Lay still. You're doing good.
Great. You're doing great.
Everything's okay.
You're doing great.
All right. So the question is, do I take this out? No. You're fine.
You're doing great. Just relax.
Take.
You're doing really well.
Shot.
Keep your hands still, okay, sweetheart?
Don't move.
Moving all over the place. Keep your hands still. You're in surgery.
You're doing really good. Just lay still.
Okay.
Shot. 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 All right, we're in, like Flynn. And now you can work on getting her a little more comfortable. So we're into the disc at L5-S1 at this point. And she is moving a little bit, but the reason is not all patients we can put to sleep the same way. And the reason is not because of us or the drugs, it's because of the patient. So a patient who doesn't move air freely through their upper airway, we call that obstructive. We don't want them obstructing during surgery, so we got to be more careful on how much anesthesia we give them. And we have to give them a little bit less. Shot. So basically what I'm saying is with her, because of her obstructive sleep apnea, we have to be a little less sedating for her. Keep her a little more awake. Make sure she's breathing. Lay still, you're doing great. So the good thing is this is a one level, right? Shot. We're only doing one disc here. Shot. For some patients, we have to do 2 or 3 discs. It's a bit of a more difficult case to do because of the depth of anesthesia. Shot. All right, that's good. Shot. Yeah, I'm going to bring this back a little bit. Yeah. Shot. Shot. It's kind of hard to see where we are. Go ahead, take a shot. She's moving a little bit. That's good. That should be good. Let's get the fluoro out. Yeah, I'm fine. She's moving. No, it's okay. Let's keep her safe. Safety is the most important thing for the patient. So we are where we need to be at L5-S1, and I feel pretty good about it. So we're going to go in and take a look at this disc and get it repaired. We doing all right, Dr. Burndes? Grab her. Yeah, she's got quite an incline to her disc. Laser. Laser on. Sometimes I find myself a little more lateral in the disc than I want to be. I want to be more medial, but the reality is that that patient's facet just won't let you get more medial. So what I do then is I will actually get started laterally, but then I'll start to take down the medial scar tissue in the disc, and that'll allow me to get more medial. So it really works quite nicely. Watch that loop. That cannot hit my face. Now you got to get your hand up there. You can actually see the blue nucleus there from the tear. So this is really the part of the disc herniation, the annular tear that's all scarred up. This is really what we're after right here. This is where all the pain comes from. What's going on, guys? Are you guys okay? I need about 5 more minutes. This is not a major big thing. Seems to be responding quite well to the laser, as long as I can get the angle I want. So just to let you know, some endoscopic surgeons, they actually do their whole surgery in the foramen, and other endoscopic surgeons like me do the surgery, are we okay? Yeah. In the disc. So this right here is kind of a combination of being within the disc and within the foramen, both. You okay, Monica? So we're looking between the bones right there at L5 and S1. And you got a little bit of inflamed fat there. A little more of that annular tear at 12 o'clock, right where the laser's doing its job. You can see how much inflammation there is here because the end plates are very red. So inflammation is what causes all the pain. We want to get rid of the source of inflammation, which is the herniation stuck within the annular tear.
We have a question from Bo from YouTube.
Grab her. Come on, you got to get that, man. What? No one's asked a question? Is that what you just said?
We have a question from Bo, YouTube.
Yeah.
What's the recovery time associated with this procedure?
Recovery is 1 hour. She's a little bit more awake. Recovery is 1 hour. I need 2 minutes. In 1 hour, she's going to be fully recovered. 1 hour after the surgery, she'll be fully recovered. And most people just take Tylenol for pain the first day, and then they're done. Okay, we're pretty much done.
Okay, sweetheart. Keep your head down. Hey, Kristen, come over here real quick. Keep your head down for a minute. Give me some more medicine, okay, sweetheart?
We're almost done.
We're almost done. You're doing great.
Yeah.
You're doing great, sweetheart.
Yeah, almost done. We're just giving her some encouragement. This is the worst area where most of her pain is coming from. I want to make sure there. I got to get that last bit right there. And then we're done. Another minute. See that blue stuff at 12? Yeah. I always talk about we're attacking the beast, the dragon, and the dragon never wants to go quietly. You know? It always wants to put up a fight. Extremely painful stuff right here. 30 seconds. I think that's going to be about it. Done.
Lights on, please.
Scope off. I don't need that. All right, we're done. Went really good for her. We have the roll. So we're going to take our tube out. And put some pressure while we wake her up. She's still a little sleepy. Now we were able to treat L5-S1. That's what we came here for. That's the worst disc, and I think that's her only disc that's causing her pain. Any questions from our audience?
No, sir.
All right, so because we went around the spine through a hole that's already there called the neuroforamen, there's no bone that had to be removed, no ligaments that had to be removed from the spine itself. And everything was done through a tiny hole, 7 millimeters. You see this right here?
Yes, sir.
So we're just putting some pressure on the muscle and make sure it's not bleeding. And then we're going to put a Band-Aid and we'll get her out of here and she'll go home in an hour. The last patient we did, she was a nurse. We did the left L4-5-5-1. She's already gone home. And her pain is also gone. And she can feel her leg, she said, which she wasn't able to feel before surgery. We're going to have some nice testimonials tomorrow that we could add to the YouTube channel. All right, type up your questions. I'll be over there in a couple of minutes to answer them for you. Feel free to write questions. And if you haven't, check out the Deuk Spine Institute. The Deuk Spine Institute app. go to the App Store and type in Deuk Spine Institute. We have a free app. You're welcome to download it and use it. It's got great information. All right. Thanks, everybody. Dr. Deuk Majan here at Deuk Spine Institute. It's Groundhog Day, I believe, right? February 2nd, so 2/2/2022. And I'm here with one of my patients who traveled from, where did you come from?
Tennessee.
Tennessee. And why would you travel from Tennessee to Florida to Deuk Spine Institute?
I have been miserable for months, and I found you and did a consult with you and knew this is where I needed to come for good treatment and relief.
And what kind of problem were you having that brought you to Deuk Spine Institute?
Severe lower back pain, which turned into sciatica, and it was down my left leg constantly. I slept about 2-3 hours a night at most, and I could not sit for more than 5 minutes, and I had to be standing up.
And did you try some other treatments in Tennessee or elsewhere?
I did. When this whole thing started and it was a bad flare, I thought I'll be able to work through this. Chiropractic, physical therapy, 2 spinal injections, massage therapy.
And how did you know those treatments did not work for you?
I had no relief at all. My sleeping continued to get worse, and my pain was never better.
And do you have relief now?
Absolutely. I would say I have 95% relief.
Awesome.
And it's amazing. After surgery yesterday, I put on a back brace. I walked out of here. I sat down yesterday for probably over an hour and had lunch. Last night, in bed, I had 0 pain. It's a miracle.
Well, we're very happy that you're doing so well. And your surgery was a great one because we fixed 2 discs. You had herniated disc at L4-5, L5-S1, and you can see in this footage right here that we grabbed the herniation out, and it was one of the herniations was really big, and it was really gratifying to get it out because it was resting on your sciatic nerve. Once we took it out, I think your sciatic nerve probably felt a sigh of relief.
Yes, absolutely.
Yeah, and the surgery went very well. The laser debridement of the annulus went well, and I feel like your pain's going to be gone. It's not going to come back.
I would agree.
All right, very good. Well, is there anything else you want to tell your viewers?
Folks, if you're suffering and you're not getting relief from those non-invasive therapies, then come see Dr. Deuk and have him look at your MRI and give a diagnosis. And if you need to have surgery, you come down here. He will take good care of you, and so will his team.
I really appreciate that. Thank you so much.
Thank you.
I'm Dr. Deuk Majan. It's January 26, 2022, and I'm here with one of my patients who you underwent the Deuk laser disc repair on your lower back for some herniated discs about a week ago.
Yes.
How are you? I'm Dr. Deuk Majan, and welcome back. We just finished performing a Deuk laser disc repair from the left side at L5-S1. L5-S1, of course, is the L5-S1 disc, which is a cushion located between bones number 5 and S1, which is the first sacral vertebrae. And the disc is right here. If you look at the spine, this is the front, and this here is the back. So there are really 2 types of joints in the spine. There are the discs and there are the facet joints. And for every disc, there's a left facet joint and a right facet joint. And the truth is that any of these things, whether it's the disc or the facet or even the bone, it can cause pain. Now, bones usually don't cause pain because they would have to be fractured or infected or have a tumor growing in them, which is really a fracture, by the way, that causes the pain. But the tumor itself can cause pain as well. But the tumors and fractures and infections of the spine are rarely ever the cause of pain, less than 1% of the time in the general population. The vast majority of back pain comes from this structure right here, called the spinal disc, or disc for short. The second most common cause of pain are these joints back here called the facet joints. I don't think you guys are seeing that very well. Turn on the light, please. I apologize for the bad visual here. Anyway, the facet joints are located here, and there's another one there, and they literally run up and down your entire spine. Don't pay attention to the metal. We didn't do that today. So here's the L5-S1 facet joint right there. And then, of course, the L5-S1 disc is here. I actually went through a tiny little gap right there to get into the disc. I had to use a needle first, then a guide wire. We put a dilator down. It spread things open and made it easier. And then we put a tube in, and I used the tube to do the surgery with the laser and the endoscope. And what I was saying earlier is sometimes these facet joints, you want to come lateral from the side, and you want to get in right where the tear is, okay, right where the herniation is and tear is. But sometimes this thing, the facet joint, is so big, it actually grows sideways over here, and it pushes you lateral. So you come into the disc laterally from where you want to be, in which case you have to start removing some of the tear laterally, and then you work your way more medial. And that's what I had to do today. And it worked out fine. But you have to be really comfortable with the anatomy to be able to do this kind of surgery. You got to know where you are at all times and make sure you're in a safe place. I expect this patient to do well. She has a pretty collapsed disc, but her pain was coming from inflammation. We could see it in that area of the tear. It was spreading onto the bones as well. On the end plates, you could see the pink color, which is the inflammation. I'm Dr. Deuk, and do we have any questions about the surgery?
Yeah, we have a question from Mike, Facebook.
Mike, thank you. You've made my day asking a question. Mike from Facebook.
If I have a cerebral foraminal narrowing, a large disc osteophyte complex, and a bulge at L5-S1, he's asking, am I correct that the Deuk laser disc repair is only addressing the inside of the disc? So he's asking,
Yeah, great question. So he's saying if I have a herniated disc osteophyte, which is a disc herniation that's calcified because it's been there for a while, and severe foraminal narrowing. Okay, the foramen, just so we all know what the foramen is, that's what we go through right here, the neuroforamen. And I'm going through the foramen, which is why I don't have to remove any of the bones or ligaments. I'm coming from the side. He's asking, so is it my understanding then that you're only fixing the inside of the disc? The answer is no. If you notice at the end of the surgery, I'm outside the disc. I'm looking at this whole area, and I can see the nerve coming around here, and I can see that we've removed everything outside the disc as well. So what really happens with the surgery is, as I go in with the dilator, I literally push the herniation back into the disc, and then I use the laser to zap the herniation inside the disc, break it up, and take it out. So it's a much safer technique than trying to remove a disc herniation out in the foramen where the nerve is, because you can actually damage the nerve root. So this is fixing both the inside of the disc problem and the outside of the disc problem, both.
We have one more question from Bo.
Thank you, Bo.
What is the difference between a protrusion and a herniation of a disc?
So Bo asks, what's the difference between a disc herniation and a disc protrusion? Great question, Bo. Very, very confusing subject, but in the end, it's really quite simple. The disc really has two parts. It's got a wall, that's the yellowish stuff, and then it's got a jelly center, which is the red. Whenever you have a tear in the wall, and then you start bending and twisting and lifting things, it puts pressure on the bones. They squeeze the disc, and they basically, it's like squeezing toothpaste. If the cap is off, the toothpaste is going to go right out through the tear. So there are many names for the same thing. They're all called a disc herniation. A bulge is when the disc herniation is just small. You know, it's just small. It's not that big. And then a protrusion is when it sticks out further. It's kind of like somebody saying she's pretty, or she's good looking, or she's hot, or she's attractive. I mean, it's literally saying the same thing. And I'm sorry, please don't find me sexist. You could say he's hot, he's good looking, he's attractive, he's handsome, whatever. The point is the adjective or that you're using to describe the situation it's really the same thing. It all means it's a good thing, but in this case, obviously, protrusions, herniation, slip disc, herniated disc, bulging disc, ruptured disc, extruded disc, they're all the same thing. They're a tear with jelly sticking out. And they all need the same treatment, which is the best treatment is the endoscopic surgery we do. Now, do I do other treatments? Absolutely. If you go back and look at my YouTube videos, you'll see that I have broadcast spinal fusions, microdiscectomies, laminectomies, ACDFs, PCDFs. I do all spine surgery. And the best spine surgery by far for the patient is the endoscopic laser surgery. And that's what we use to treat herniated disc, bulging disc, ruptured disc, protruded disc. I hope that explains it. It's just different people choose different. I wasn't an English major, so I don't know if it's an adverb, adjective, noun, but it's basically the same thing. Okay.
That's it.
All right. Hope you enjoyed the surgeries. We'll see you.